Next important thing in the dermatology section is about the pressure ulcers. Hope you are aware of it. Pressure ulcers are called as bed sores or decubitus ulcers. These ulcers occur because of lack of blood supply. That's necrosis of the tissues because of avascular nature. There is no blood supply due to constant friction of the pressure bearing areas. They develop, especially old debilitated patients, they develop such conditions as pressure ulcers. The importance of pressure ulcers is you also need to, in the ICD side, you also need to code for the stage of the ulcer, whether it is in stage 1 or stage 2 or stage 3. Accordingly, please take the codes. So ICD-10 will give you an idea about how to select the code for a pressure ulcer depending on the stages. Okay. Now, from the coding perspective, especially of the procedure side, a pressure ulcer is commonly being excised other than debridement or dressing. So the physician also excises the ulcer. So what are the pressure bearing areas? We have the ischium, we have the trochanter, we have the sacrum. Those are the pressure bearing areas. So they can remove the ulcers from those sides as well. So in order to code for pressure ulcers, the codes will vary depending on these conditions. One is a primary suture. That means they excise it and they are going to suture it. That's simple. So code for the anatomic side and what is a procedure. Next, it is a flap closure. So they might place a muscle flap or a dermal flap or a skin flap. Code for that. Sometimes they prepare for the placement of a muscle flap. In that case, code for the preparation, and if they are also placing the flap, you can also code for the muscle flap. And at last, you can go for the, sometimes along with the ulcer that might go deep into the bone and the provider might have to remove a part of the bone. So that qualifies for an ostectomy. For example, the provider is going to excise an ulcer which is there in the trochanteric region, and along with that he is also going to remove a part of the bone. So in this case, you need to report it as excision of the trochanteric decubitus ulcer with ostectomy.